guys for setting aside time for this today. If you haven't met me before, or if this ends up on the internet, I'm Charlotte Marquis. I'm an anesthesiologist, and today I'm going to talk about how to use RU, high flow oxygen unit. So today I just want to spend some time talking about what are maybe some good patients for this unit, what are some less good patients for this unit, and some recommended settings and a couple of situations where it's really helpful. And then in the second part, I'll show you guys just how we set it up, and we'll take it from there. But yeah, we just got this new unit up here, and we're going to get one for our Overland Park Hospital. And these will stay in the doctor's offices, and then we can bring out the equipment as needed. The attachments to the unit are going to be in central supply. So the tubing, the cannulas, the sterile water that is all required to operate the unit, those are going to be kept in central for the patients. But why do we like high flow oxygen? So what's the point? Why would we choose this over maybe like a Snyder or an oxygen kennel or, traditional cannulas? Or to body temp. So you guys probably know that when you get oxygen from a pipeline, it's going to be fresh and cold. So that can really cool down a patient, which is fine if that's what you want. But if you have something very small, if you have a patient that you're trying to keep the same temperature, we can warm this anywhere between like 32 and 38 centigrade. So this is a great option to provide warm gas. It's humidified, so the gas that comes out of a wall outlet for traditional oxygen therapy, that's going to be just dry. So the really nice thing about this is that you can add sterile water to it, and it's more like breathing in and out. It's kind of natural for them, so to speak. You can also change the oxygen percentage, so you can change the so-called FiO2. So when you have oxygen from a wall outlet, that's always 100% oxygen. But when you have it on a high flow unit, you can change it. You can start at 100 and then you can kind of titrate down. So this is a fabulous option for animals that might be on these cannulas for a couple of days. We do know that it's really important to have both a blend of oxygen and nitrogen to help keep the alveoli and the airways open. So long term, we can have things like so-called oxygen toxicity. We can also get collapse of the lung from high oxygen. So it is nice just to be able to change that and kind of turn down our therapy from like max level 100% to like 60%. So that's a really nice feature of it. We can use this on both dogs and cats, variety of sizes here. So generally speaking, with the unit that we have in hospital, it's called the Vapotherm, anywhere from 1 to 40 kilos. There are a couple of units that will deliver like up to like a patient that could be 70 kilos, not ours, so 1 to 40, generally speaking. I feel that compared to traditional oxygen therapy or the kennel, lots of dogs and cats are totally fine wearing these cannulas. I think partly because it's warm and it's humidified, it just feels like they're breathing in and out. So I think if you had a patient that was particularly fussy, this could be a great option. The other reason we really like this is because the flow is so high, it actually helps keep the airways open, so it provides something called CPAP, which is continuous positive airway pressure. So that is awesome for patients that have lungs that are plugged up with infection, fluid, blood, things like that. That pressure from that very high flow is going to help to serve to keep those airways open. So it's a really awesome way that we can help support patients with really often pulmonary disease. So what patients can have it and who maybe shouldn't, there's going to be a long list for each. Generally speaking, any animal with like acute onset respiratory distress that has not resolved with symptomatic therapy, that would be a good candidate for that. So any animal in ARDS, acute respiratory distress syndrome. Pneumonia cases, so if you have a patient that is not doing well in traditional cannulas or the Snyder, this is an awesome option. So like horrible aspiration pneumonia, fungal pneumonia, barium pneumonitis, great candidate for this. We could try that out. Fungal disease. Pleural space disease, so animals with pylothorax, hydrothorax, chylothorax that are not doing well with cannulas and a chest tube, fabulous option for these guys as well. And then the ones that have gas-trapping diseases, so COPD, episematous disease, which I feel like we see less often in small animals, but yes, you can absolutely do this for them. Heart failure, forgot this the first time around in my first talk, but certainly animals that have cardiogenic and non-cardiogenic pulmonary edema, great candidates for this. Helps keep those airways open, really helps with their work of breathing, takes their effort down, they don't get as exhausted as quickly. Couple of patients who maybe shouldn't get this. So this would either be candidates where it is challenging to deliver, or the patient's not going to be amenable, or it's detrimental to the patient. Upper airway obstruction. So in order for the patient to get high flow, they need to have patent, nice open airways, can't be a lot of discharge. So if you have a patient that is at risk of obstructing its nares or its larynx, I would not recommend high flow therapy, not because it would never help them, but because that's going to be an animal that needs to be intubated. So that's a patient that needs like a more advanced form of therapy. Pneumothorax. So the community is split on this, okay? Because this provides a lot of fresh gas flow and provides that pressure to keep some of the airways open, the concern is that if we have a patient with pneumo and we put that extra pressure on them, that it can develop into a catastrophe. So intention pneumothorax, which will result in cardiopulmonary arrest. Now, I've certainly done it in patients with pneumothorax. I think something you do need to be prepared for is checking the heart rate, pulse ox, blood pressure. And usually those patients I already have a chest tube in, and like traditional cannulas have not worked. So I think if you guys are willing to do that, or think about active suction for the chest, like a Pleurovac, yes, I'm totally fine with that. But you do need to be so careful. It's quite scary to get that started. Skull or facial trauma, mostly because those guys will have lots of facial pain. They might also have discharge or fractures like in their nasal bridge here. So I think ethically, like it's not the kindest option for them. And if they have nasal discharge, it's just hard to deliver that therapy with the cannulas there. Central nervous system disease or like some type of brain tumor. So if the reason the animal is breathing poorly is because their breathing control is not very good anymore, that is an animal that probably needs to be intubated. Not like this would never help them, but if they physically are not taking good breaths in and out, or it's a pathologic pattern like Kussmaul's respiration or Biots or Cheyne-Stokes, that's an animal that needs to be intubated. Toxicities. So animals that eat tons of muscle relaxants or methamphetamines that have like disordered breathing, those are again animals that probably have a central component, and those are animals that, along with medical management, I would mechanically ventilate if you really needed to. Very big dogs. Like, yes, we can put 40-kilo dogs on this, no problem. But if you're trying to achieve the flow rate to achieve CPAP, we do get some type of weight limit around 40. So we can put 70-kilo dogs on here. I don't care, but we might not get the CPAP you want. So just so you guys know, that's kind of our limit there. Very aggressive dogs and cats. It's a great machine if they're friendly. They usually tend to just sit with the cannulas on without sedation. Lots of these pets are sick, so they're desperate for it, and they just kind of sit there. They're like, oh, I feel better. If you have a vicious dog or cat that is not tolerating the cannulus, even with sedation, local regional, anxiolytic medication, but they need oxygen therapy, I would mechanically ventilate them too. But most of the time with sedation, they actually do just fine. But if you have something vicious, then I probably would not. So I guess the next part of this is how would I set up, or like how do I know what the pet needs? So there's a couple things you need to get in order to get the unit ready. So the unit sits in the doctor's offices. It should be locked like on all quadrants. And then wheel it out slowly, just because it's really top heavy. You don't want it tipping over. It's like a $20,000 machine easily. Couple things we're going to need. So first, you're going to need a cartridge and cannulas. So the cartridge is the part of the machine that actually helps warm up the water and helps kind of atomize it into the patient's circuit. So we have two types of cartridges. We have high flow and low flow. Just depends on how big the patient is, like your anticipated flow rate. So typically, to start a patient on the circuit, I want to do 1 liter per kilo per minute, 5 kilo cat, 5 liters a minute, 10 kilo dog, 10 liters a minute, 40 kilo dog, 40 liters a minute. So if I have a cat that's going 5 liters a minute, I'm going to pick my low flow cartridge. So that's anywhere from 1 to 8. If I have anything bigger than like an 8 kilo dog that's going 8 and above, you want to pick the high flow. So that's the difference. It's still delivering high flow therapy. It just depends on like the volume per minute. Does that make sense? So you select your cartridge and then your cannulas. So the cannulas need to be appropriately sized for the patient. We have anywhere from neonatal, which are like a suggestion, they're like this big, and then we have adult ones, which are much larger. It's like two little prongs. They're meant to sit inside the nose, and then the tubing is like quite thick and rubbery, and it's meant to be that way so it can support the high flow. We should not be jerry rigging alternative cannulas to fit the high flow set. It needs to be this specific cannula. And then the cannulas will tell you the size, so pediatric, neonatal, medium, adult, and they will also tell you the rated flow rate. So this is very important too, and I'll show you guys that later. But on the front of the cannula, it will say like pediatric, you'll see it small, and then it will say 1 to 5 liters a minute. So it needs to be sized for the patient, but also needs to be sized for the flow rate. So if you were trying to deliver a flow rate higher than those cannulas, I would try the next size up unless the patient absolutely cannot fit it. So definitely look at that too. So you got your cartridges and you got your cannulas. Then you actually turn the unit on. So there are a couple of things we need to plug in with the unit. We need to connect it to oxygen on the wall. And then once that's there, we turn on the compressor at the bottom. So the compressor is the part of the machine that allows us to blend room air and oxygen. So if you're wanting to blend therapy, you do need to have that turned on. And then at that point, what you're going to do is get the cartridge into the unit, attach it to the water source, allow it to fill up the cartridge. It will tell you if it's had enough or not. And that usually takes anywhere from like 200 to 240 mils of sterile water just to get the unit started. The usage of sterile water per day depends on the flow rate, of course, just like with isoflurane and the flow meter of oxygen. But generally speaking, it's going to take anywhere from like 500 to 2 liters a day, depending on like how much you're using. Like small dogs and cats, 500 a day. But in a big dog, you might be replacing that bag a couple times a day. So that's that. And then you pick your settings. So you're going to select the flow, the temperature, and the oxygen percentage, and it's just a rotatory knob. And I'll show you guys how to do that. And when it comes to the temperature, because at first it's just going to come out of the wall, and it has to go through the cartridge, get warmed up, and get dumped into the patient, it's going to take 5 or so minutes for it to come up to temp. You can certainly start it before then. But what you might notice is that when the air first comes out, it's nice and cool, but as it starts to warm up, it will be okay. And typically the temperature button will flash until it comes up to temp. But pretty user-friendly. And then in terms of operating it, it's really just one button, 1 or 2. So there's a rotatory knob to pick your selections, and then there's a pause and a standby. What else do I have to say about this? In terms of charging for the unit, it's a couple $100 per day. So we have 2 charges that are going in, at least at our hospital. So if you have a patient you think is going to be on it 12 to 24 hours at least, we have like a per day charge, I think. And then if you have a patient where you are genuinely just buying time, you just need a couple hours until the owner decides to euthanize or mechanically ventilate, we have a separate charge for that just because we want to charge differently for like short versus long-term therapy, and the equipment is not necessarily replaceable. Like yes, we have plenty, but we can't just jerry-rig with cannulas. We have to use the ones that are specifically rated for this. But yeah, that's the indications for high flow therapy. The next part, I will show you guys how to use the unit. So I'm done with that part if you wanted to like do it. Welcome back to part 2. I'm Charlotte Marquis. I'm an anesthesiologist, and today I'm going to be showing you how to set up the high flow oxygen unit. So this is the unit here. I have it locked on a couple of quadrants so it doesn't go flying off to Tennessee. And I have plugged in both power cords. So there are 2 power cords for this unit. There's going to be one that powers the actual high flow oxygen unit. And then there's going to be one down below that we may not see with the camera, but that's the compressor. So if you want to blend, you do need to have both of those plugged in. And when you do plug them in, the top part of the unit comes on. It will not start delivering anything until you tell it to. So the first thing I need to do to get this set up is that I need to get in here my cartridge and I need to get my cannulas attached. So I'm going to pretend I have a patient going on high flow therapy, so I've picked my high flow cartridge. And there's a couple things in this packet that you're going to get out. So the first thing is the delivery housing. So this blue part attaches to the patient's nasal cannulas, and then this part that looks like a Lego, that's going to go into the cartridge. So I'm going to get that out here. And the tubing is very stiff, and it's meant to be that way to withstand some of the high flow that we're giving to the patient. So we can just kind of unwind it like that. And then this is the cartridge, which I will show you guys how to get into the machine. Just be kind of careful when you take off the packaging because it does need all of the parts to just kind of fit together and interdigitate, so you don't want to just like casually rip all of those off. So with the cartridge here, this is the part that slides into the machine, and you will see inside the high flow unit there's like a silver bar, and it just kind of lines up inside there. So that is how it is meant to humidify and warm the gas, is like making contact with that plate there. And then this is the part here where the cannula delivery set is going to attach into the cartridge. So I'm going to do that first. And again, it's quite stiff. You do have to press quite firmly. It doesn't make like a very obvious snap, but just until it's connected, and that's plenty. So the next thing that I want to do here is I want to slide this into my unit. I'm going to go right to the back here and just slide it all the way down. And it doesn't snap or anything. You just make it so that it fits like nice and snugly. I'm just going to let this part drop for now. And then now what I have to do is get water into the set. So I use sterile water for inhalation, and I take off my spike here. And like, yes, this water is going into a patient's nose, so like it's, you know, slightly contaminated. It doesn't need to be like the most aseptic ever. And you may find that it's easier to do this at arm's height instead of reaching up, but you want it to be screwed in quite tightly there. Perfect, and we'll hang that up there. Awesome, so this cannula's here. I'm gonna shut the window here, and now I'm gonna let this go. So you're gonna see water start to drain in. Now, because of the way this works, it's never gonna like just dump out the other end, okay? So this is important for filling the cassette. So we can see here that there's kind of like a little bottle icon with water. That tells us that the cannula does not have, like the cassette does not have enough water. So all you have to do to make that happen is let that go here. And we're just gonna kind of squeeze it in a little bit at a time. And it can sometimes take 200 to 240 to get in there. And it looks like it started to disappear. So I'm happy with that. Now, while you're using the cannula, you do want to leave this clamp open because it's going to continuously draw from there. So that's set up the way that I want it. The next thing I need to do is get my cannulas. So I've picked my cannulas for an adult patient, and I've also looked at the flow rate, so I'm happy with both of those. You may see that as you're waiting to set up your cannulas that small drops of water come down the tubing. That's totally fine. Once you start delivering this to the patient, usually the first breath or two, there's like a couple droplets that come out, but it should by no means like be shooting water into the patient's face. Again, these ones are very stiff to connect, but just wiggle it back and forth and you'll eventually get there. Perfect. So this is the way it should fit. They're nice and tightly together, and they're ready to be delivered. And these are the cannulas. I secure these very similar to other cannulas, so I do suture them in. For dogs and cats that have nice long noses, I'll make like a tape bridge and I'll do one either side. If you have a pet that has a head shaped like a basketball, so you have a cat or you have a brachycephalic, I usually like it on either side of the face. You may have to do like a little nose piercing right here just to get that to sit there, especially if you have a very tiny patient, but that's just what I like to do. Perfect, so it's just that it went into standby that it decided to have a black screen. So I've plugged this in, I have the water, I'm happy with the way this looks. Now I have to just set up my parameters. So this is a patient on high flow, so what I'm gonna do is I'm gonna click through my parameters, and you'll see that they flash, and that's the one you can change. So I'm gonna set this to 38, so body temperature, and then I'm gonna try to adjust this. You know what I didn't do, everyone? Didn't plug in the oxygen hose. Anesthesiologist. Okay, there we go. See, it just goes to show you that everyone makes mistakes. It's about how you come around from that you fix that. So the reason why that wasn't working was a great example of why the compressor needs to be turned on and the oxygen outlet. So you get those in, and now that you have all your cannulas set up and the water's in there, you can pick your flow rate. So right now, the unit is at standby. So what I'm going to do is that I'm going to start adjusting my parameters. So you're going to click it, and the one that is flashing is the one you can change. So any patient in acute distress, I usually start at 100. Body temperature, 36, 37, 38 is fine by me. And the flow rate is usually 1 liter per kilo per minute. So I'm happy with that. I'm going to lock those in. And as you guys can see, there is like a little bit of water that comes down first, and that's fine. But when you're ready to start delivering and you pick your settings, it's going to beep a couple of times. And then after about 30 seconds, it's going to start to deliver. So what you can probably hear is that flow is coming out of the cannula. And actually, there's not really a lot of water that's like being shot out into the patient's nose. The temp right now is 21. That's because it's going to be set at room temperature. And it will take probably 5 minutes for that to heat up. So it's going to flash until the point it reaches my set temperature. But yeah, the patient would wear the cannulas like this. And when it starts to heat up, you are going to see that change there. Once it's reached temperature and it's delivering that flow, it's going to flash green and just kind of be there. And if you needed to stop this for any reason, all you would do is just press and hold, and then it should go into standby, and then there's no more flow there. And then to shut off the unit, like if you're gonna either move the patient somewhere or you're done using high flow, set it on standby. I would clamp this. Remember, we're gonna leave this open while we're using the cannulas. And then typically what I would do is shut off the compressor and then take the oxygen out of the line from the wall source. Now, something that we do need to be watching other than the water and like how the patient is doing is that on the side of the compressor, there is something called like a maximum water fill line. So when the compressor is taking gas from the room, it's going to take the extra humidity and dump it into this bottle. So the bottle down here is filled with nothing and it should be pretty much empty. This should have water in it. So water up here, but not water down here. So make sure you're checking that water trap a couple times a day, maybe every opportunity you have to check the bag and check your flow and temperature. I would also check the water trap. But that's pretty much it. It's a pretty intuitive unit. These are single use only. We do not re-sterilize these for patients, especially because a lot of these are infectious patients. But yeah, super easy to use. And then when we're done with this, all we have to do is we slide out our cartridge, we take our water off, and then this is disposable. And then as soon as you start turning off the compressor and taking away the wall surface, the unit just powers down.